Hello dear patients, today we are going to review the case of red spots on glans penis. A man came to us and for quite a long time, for about 3 years, he had been having red spots on glans penis. He went to his dermatovenerologic dispensary and there, without any analysis done, the diagnosis of candidosis was set there, candidosis of glans penis. They treated him for a long time using different ointments by type of clotrimazol. They treated him unsuccessfully. Then they abandoned it all and said that the treatment is not successful because you are not circumcised. The man did circumcision, however there was no effect from it. So in about 8 months after circumcision, after using many ointments, often they were glucocorticosteroid ones, and had little effect, he went to our clinic. First of all, we see such little red spots. They are often covered by scales. You can see scales on the surface of one of the spots. They are located only on glans penis, they are absent in other areas. It's no doubt that this case is quite a non-standard one. He did not do any other analysis apart from analysis for sexually transmitted infections, and the first thing that has to be done is to recommend this man to not wash glans penis and to take analysis for fungus that can be insensitive to anything, and we have many of such cases when we take analysis for candida, and it turns out that after all of these painters who like to paint with anything and after the patients use different ointments themselves, this fungus becomes resistant to everything. Second thing is bacterial culture test for bacteria, and sexually transmitted infections were excluded in this case. Secondly, blood tests should be done for allergy and sugar on an empty stomach. I'm not going to talk about what is a blood analysis for allergy and sugar, as you'll watch a separate video about it. All of these analyses were normal. Indeed, this condition resembles psoriasis. After patient questioning, psoriasis was found in his father. The patient himself never had psoriasis though. So these small spots covered by scales that can sometimes be scraped. However, scraping of glans penis is not the best thing to do. However, we can get such erosion even without all of the classic symptoms of psoriasis, but we still can get quite a clear picture. An ideal would be to do biopsy or histological study. However, to do it if it's localized only on glans penis would induce quite a big defect on glans penis. It would induce the appearance of scar, and that's why we didn't do it after setting a clinical diagnosis of psoriasis. We prescribed a classic anti-psoriatic therapy, sodium thiosulfate, calcium gluconate, B12, folic acid, etc. You can watch a separate video about treatment of psoriasis on our channel. Externally, anti-psoriatic ointments were used by type of Naphthoderm, etc. As a result of that, within a month such rash completely resolved. I can say that based on my experience, circumcision doesn't help all patients with psoriasis. Often in books of so-called smart professors it's written that in uncircumcised men psoriasis can often be on glans penis. Even in circumcised men, as in this case, psoriasis can appear on glans penis. This is quite normal. Indeed, if on average 1.5 to 2% of population are affected by psoriasis or they have it, then this disease is observed in its own way in every person. Considering that I often deal with sexual organs, then indeed psoriasis often appears on this place. The resolution does not come so easily for every patient. Circumcision does not bring a positive effect in every patient. Moreover, in some cases so-called Kobnes symptom or Kobnes phenomenon is observed when additional rashes appear around the scars, around the sutures of circumcision. So it's not always safe and it doesn't always bring the effect. So try not to start any therapy without analysis. Try to first of all set a diagnosis if you have any rashes, and don't lubricate it, please. First do analysis, at least the ones that are necessary, and only then you can start some kind of treatment. If there are any lesions in the area of sexual organs, you can consult venerologists and urologists of our paid medical center or dermatovenerologic dispensary in Moscow. We have experienced specialists who do diagnostics and treatment of such diseases. We are waiting for you in our clinic. Please subscribe to our channels on YouTube and Instagram. Thank you for your attention.